So, Marion, high-income countries, I mean, Australia is a high-income
Yes.
country, but why is it no other high-income country has come close to what Australia has actually achieved?
So in the days where cytology was the test, we were amongst the best in the world, but there were others with us. And the reason I think that we did very well is our government, and this was before I came back to Australia from my overseas training, the government had really invested in organising the screening program and had moved away from just doing the test to organising a program. And that came to a very early recognition of the need to regulate the quality of cytology laboratories after some international scandals with low-quality cytology. It came to organised health promotion that continued through the years, and also to the establishment of screening registries to really track people through the screening pathway, to send reminders to those who are overdue for follow-up when their screening test was positive. And so those three things have been really, really important in our cytology-based program. And then we had the early decision, although we weren't first in the world to go to HPV primary screening. The Netherlands and I think Turkey beat us to that, but we were early adopters of HPV primary screening. So we built on strong screening program fundamentals with a better test early on, and I think that's why things are going well for us. But I don't want to, I want to be humble about the fact that we've had great support from our government. We haven't experienced the challenges that other countries have. And so we are always learning too. And we also have inequity in Australia, so we have to address that as well.
So, Marion, high-income countries like Australia have invested a lot in this whole initiative of vaccinating, treating, screening and treatment. What about low and medium-income countries? I mean, you worked very much with data analysis. We are in Malaysia still trying to get a registry established and going, which, we will have to fall back on when it comes to executing these programs well. How do you suggest low and medium income countries can actually adopt data and analytics when resources are limited and not always available?
So I think what's important to understand is that there are tools coming that will make it quite simple and straightforward to generate the business case, to generate the total resourcing required, the return on investment. And that will not require a consultant for 6 months or expensive exercises. This is really democratising cost effectiveness evaluation and making it available to low resource settings. I think all of the countries that are classified as low and middle income will have their primary data populated into the model, and then a variety of different inputs can be put in. Do we vaccinate boys as well as girls? Do we do multi-age catch-up? How often do we screen in a lifetime? Is it twice in a lifetime or every 10 years or every 5 years? Those sorts of variables can be put in to generate the resource requirements and the local costs of the tests available to you. So I think it's really important that countries, as you say, have access to these tools to really build the case, because we need to tell stories to be compelling, but it needs to be underpinned with strong data supporting those stories.
And I think in terms of Malaysia, how we've started what the movement or even the first steps is really to work with professional societies. We've worked with the Obstetric and Gynecological Society. We're starting to work with the academy, and very important to work with media, whether it's radio or whether it's a newspaper, to generate that interest, and then to work with our women leaders, and in our case, our female members of parliament were very important in bringing the case to be voiced and be discussed at the parliament level. To say women only is a bit unfair, because I remember distinctively having our Deputy Minister of Health hold a swap in Parliament saying, why isn't this available to all our women? And I still have that photo captured. So I do think it needs multi-level advocacy, not just data, but trying to get the voice to sing it louder, to shout louder to get this done, because it's something worth doing.
And I think there's an important thing that Rose is doing, and that is by going out there and doing screening and undertaking this model, instead of telling the government how it can work, you're showing them how it can work. Because when you make deep change like this, you get a lot of people saying, but what about this and what about that? And sometimes the only way to overcome that is to demonstrate that, yes, it's not perfect, but look at the rates of follow-up that Rose is achieving with these elements. You know, Malaysia, like many countries, highly capable of doing this, and it's a matter of prioritising it. So it's telling the stories, demonstrating or showing that it works, and having the underpinning data and business case. It's got to be multi-pronged, as you say.
It's very scary to make the first step into the unknown. And many people will say, get it perfect first. Line all your ducks up first, then take the first step. But you know, we've learned that sometimes we know that, what's the saying, perfection is the
enemy of
good. And so taking that first step, getting some help along the way is an important, it's courageous. You need to do that, and someone needs to do that. And in my personal experience, there's been very few experts who would say, "Nah, I won't help you." I think if you go to globally, there are enough who are prepared to lend a hand, and I think to reach out to those who are able to, expertise-wise, will be a really good step forward as a start.
And I think we in Australia have got an obligation to help in the region. We've got a responsibility to use what we've learnt from screening over the years to help our neighbours.